Is your liver dying? 10 weird signs of liver damage. The liver is a remarkable organ that serves as a crucial backup for other organs when needed. It steps in to support bodily functions such as filtering toxins when other organs, like the kidneys, may not be performing optimally. Furthermore, the impact of liver disease extends beyond health, posing significant economic challenges. Surprisingly, the treatments for liver disease can be exorbitantly expensive, reaching costs of tens of thousands of dollars. In the United States, the total annual cost of liver disease is estimated to exceed $100 billion. This figure includes direct healthcare costs such as hospitalizations, medications, and outpatient visits, as well as indirect costs like lost productivity due to illness and premature death. The average annual cost for a patient with chronic liver disease can range from $6,000 to $14,000, depending on the severity of the condition and the need for specialized treatments like liver transplantation, which can cost upwards of $577,000. It's distressing to consider the serious price of not detecting liver issues early. But here's the mind-blowing part. Some of the signs of liver damage are so peculiar that you might not even realize they're linked to liver health problems. Imagine experiencing symptoms that are so unusual that they fly under the radar of typical health checks. Would you even think of the following as warning signs or just run-of-the-mill problems we may face daily? Your liver is one of the hardest working organs in your body. It processes everything you eat and drink, filters toxins from your blood, and even aids in digestion. This remarkable organ carries out numerous vital functions and sometimes compensates for other organs when they aren't working properly. But what happens when your liver starts to struggle? When it becomes overwhelmed, it can manifest in some surprising and unusual ways. Well, luckily, there are specific signs you can watch out for to catch liver damage early. By recognizing these signs, you can take action before the damage becomes severe. Let's dive into some of the weirdest and most unexpected signs that your liver might be in trouble. You might be surprised to see how many weird signs can indicate liver issues. Watch till the end so you don't miss out on any useful information for a healthier, happier life. In this video, we will discuss 10 unusual signs of liver damage that should not be overlooked. Before we start, remember that the information provided in this video is for educational purposes only and is not intended as medical advice. Always consult with a healthcare provider for advice tailored to your health needs. The information provided is fact-checked, reviewed, and verified by qualified health experts. Sign 1, itchy skin. First up, itchy skin. It might seem like a minor nuisance, but persistent itching could be more than just dry skin. When your liver isn't working properly, it can lead to a buildup of bile salts in your bloodstream. These bile salts can get deposited in your skin, causing that relentless itch. You might try using moisturizers and anti-itch creams, but if they don't seem to help, it could be a sign that something more serious is going on with your liver. Chronic itching, especially when it's not linked to other skin conditions, should prompt a liver checkup. Sign 2, spider angiomas. Next, let's discuss spider angiomas. These are small red or purple blood vessels that appear on the skin, resembling spider legs or a spider's web. They are most commonly found on the face, neck, and legs. While a few spider angiomas can be normal, especially if you're pregnant or have a hormonal imbalance, having multiple of them can indicate liver cirrhosis or other liver problems. When the liver is damaged, it can't properly metabolize estrogen, leading to these visible blood vessels. If you're enjoying the video so far, we'd love to hear from you. Leave us a comment below and let us know your thoughts. Sign 3, yellow eyes or skin. Jaundice. Jaundice is a classic sign of liver trouble. It's characterized by a yellowish tint to the skin and the whites of the eyes. This occurs when the liver fails to process bilirubin, a yellow pigment formed from the breakdown of red blood cells. Normally, bilirubin is filtered out by the liver, but if it builds up, it starts to deposit in the skin and eyes, giving them a yellowish hue. Jaundice is a serious symptom, and if you notice it, you should seek medical advice immediately. It can be an indicator of conditions ranging from hepatitis to liver cancer. Sign 4, swelling in legs and ankles. Swelling in the legs and ankles is another warning sign. When your liver isn't producing enough albumin, a protein that helps maintain fluid balance in your blood vessels. Fluid can start leaking into the tissues, causing swelling. This is known as edema. Swollen extremities can also indicate that the liver is not processing hormones and other substances effectively, leading to fluid retention. Sign 5. Chronic fatigue. Feeling tired all the time, despite getting enough rest, could be linked to liver damage. When the liver isn't functioning optimally, toxins build up in the bloodstream, leading to chronic fatigue and weakness. This happens because the liver's compromised state affects your overall energy levels and how well you feel on a day-to-day basis. If you find yourself inexplicably exhausted, it might be worth looking into your liver health. Sign 6. Nausea and vomiting. Nausea and vomiting can also be red flags. When your liver struggles to filter toxins from your blood, these toxins can build up and cause digestive distress. This can result in feelings of nausea and frequent vomiting. If these symptoms are persistent and you can't pinpoint a cause, it might be time to investigate liver function. Sign 7. Loss of appetite. A sudden loss of appetite is another concerning sign. When the liver is damaged, it can impact your digestive system and alter your hunger signals. This can lead to a decreased desire to eat, resulting in weight loss and nutritional deficiencies. If you notice that you're not as interested in food as usual, and it persists, consider checking in with a healthcare provider. Sign 8. Dark urine. If your urine appears darker than usual, it could indicate liver trouble. Normally, bilirubin, a yellow compound produced during the breakdown of red blood cells, is processed by the liver and then excreted in the stool. But if the liver is compromised, bilirubin can build up in the blood and eventually end up in the urine, causing it to take on a dark amber or brown color. This change in urine color is not something to ignore. It could be a sign of conditions such as hepatitis, cirrhosis, or bile duct obstruction. If you notice this change, it's worth investigating further with your healthcare provider to rule out or address any serious liver conditions. Sign 9. Pale stool. Pale or clay-colored stool can be another indicator of liver issues. This occurs when the liver fails to release enough bile into your digestive tract. Bile, a digestive fluid produced by the liver, is what gives stool its typical brown color. Without sufficient bile, stools can become unusually pale or light-colored. This symptom can point to several liver-related issues, such as bile duct obstructions, liver infections, or chronic liver diseases like cirrhosis or hepatitis. If this is something you're experiencing, it's important to consult a doctor as soon as possible. They can perform tests to determine the underlying cause and recommend appropriate treatment. Sign 10. Bruising easily. Finally, if you find yourself bruising easily, it might be due to liver damage. Your liver is responsible for producing proteins essential for blood clotting, such as fibrinogen and prothrombin. If the liver isn't working well, it can't produce these proteins adequately, leading to a reduced ability to form blood clots. Consequently, even minor bumps or injuries may result in significant bruising or prolonged bleeding. This happens because your blood clotting factors are reduced, making it harder for your body to stop bleeding. Easy bruising can be a symptom of chronic liver diseases like cirrhosis or acute conditions like liver failure. If you notice this, seek medical attention to evaluate liver function and determine the next steps for care. In this video, we explored 12 early signs of liver cirrhosis, including itchy skin, spider angiomas, jaundice, swelling in legs and ankles, chronic fatigue, nausea, loss of appetite, dark urine, pale stool, and easy bruising. Moreover, highlighting the importance of recognizing these signs early and providing tips for maintaining liver health, such as maintaining a healthy weight, staying hydrated, avoiding alcohol and tobacco, and scheduling regular medical screenings. We've explored the incredible signs that can help you detect liver damage early. If you're experiencing any of these, it might be time to pay a visit to your doctor and get your liver checked out. Early detection is key to preventing further damage. What was the most surprising fact you learned today? Have you noticed any of these signs? We'd love to hear your thoughts in the comments below. Your feedback is important to us, and it can also help the community. Aside from keeping an eye on the signs of liver damage, there are several proactive steps you can take to maintain optimal liver health. If you have any questions or concerns about liver health, Don't hesitate to reach out to a healthcare provider for personalized advice and guidance. Maintaining a healthy weight is essential for liver health, as excess abdominal fat can lead to non-alcoholic fatty liver disease, NAFLD, which may progress to cirrhosis or liver cancer. A balanced diet, rich in fruits, vegetables, whole grains, and lean proteins, coupled with regular exercise, helps manage weight and reduce liver complications. Hydration is also crucial. Drinking at least 8 glasses of water daily aids in toxin removal. Avoiding alcohol and tobacco is vital, as they can cause liver inflammation and increase disease risk. Regular screenings, including blood tests and imaging, help detect liver issues early. A diet high in antioxidants and fiber supports liver health, while 150 minutes of moderate exercise per week regulates blood sugar and reduces liver fat, enhancing overall liver function. Don't forget to subscribe so you don't miss out on our upcoming health videos and other tips to help you live a healthier, happier life. Please like, share, and leave a comment. Embrace a healthier you with fresh insights, nutritious tips, and vibrant wellness journeys. Stay fresh, stay healthy. See you next time.